So today I've got a really interesting guest. Patrick Mckeown had severe asthma for the whole of his childhood and into his early adulthood, to the point where he was trying anything really to cure it. And he went to study with Dr Konstantin Buteyko, famous Russian doctor, and Buteyko's methods, the Buteyko method, basically cured Patrick of his asthma, and he's been sharing that knowledge with people ever since. So he's literally helped thousands of people overcome their asthmatic symptoms, and his latest book, The Oxygen Advantage, is a distillation of what he uses, the Oxygen Advantage technique, which is based on the Buteyko technique. But it's not just for asthmatics. This stuff can help anyone. So laymen like you and I can get a lot more out of our physical capabilities, our endurance, our VO2 max, and also our concentration by changing the breath in very subtle ways, really simple ways. And yeah, Patrick's views and Buteyko's views are very different to a lot of the people that I've interviewed on this channel before, so I hope you find this really interesting. So Patrick, thank you so much for speaking to me today.
Of course.
I guess we can talk mostly about your newest book, The Oxygen Advantage. It's called The Oxygen Advantage, but the kind of, without giving away the ending, the hero of the story is carbon dioxide. Can you tell us a bit about that? What don't we generally understand about carbon dioxide?
I suppose how many times, Tom, do we think that oxygen is good and carbon dioxide is bad? Like, we literally hear it all over the place. We see it in magazines. We're hearing it often advised by many breathing instructors. And we have to consider that carbon dioxide is essential for maintenance of blood pH, and it plays a role in the opening and closing of blood vessels. And it also plays a role in the release of oxygen from the red blood cells to the tissues and organs. So that gas, carbon dioxide, really got bad press going back about 50, 60 years ago. And apparently it was one doctor, Dr. Waters, who became very critical of the gas carbon dioxide, despite it being used therapeutically in baths and also in the treatment of many anxiety disorders in the 1920s and 1930s, and despite its role in the normal physiology of the human body. So carbon dioxide is just one of those gases that it's, in terms of atmospheric concentration of CO2, not a whole lot, but our body needs fundamentally much more. And it's the volume of air we breathe. And in a nutshell, if we breathe too much air, we blow off too much carbon dioxide from the blood through the lungs. And as a result, our blood vessels constrict. So the 70,000 miles of blood vessels throughout the human body are influenced by carbon dioxide. So oxygen is not necessarily good, and carbon dioxide is not necessarily bad.
And so how does that play into the kind of things that you teach? You talk a lot in the book about air hunger, and that being more of a sign of or a sign of sensitivity, oversensitivity to carbon dioxide, rather than kind of a lack of oxygen. And so what kind of things can people do if they do experience kind of over breathing and air hunger?
Like, over breathing is one symptom of breathing pattern disorders, and that's when that person has a habit of just breathing too much air. And if we look at traits of dysfunctional breathing or breathing pattern disorders, typically involves mouth breathing, frequent sighing, frequent yawning, upper chest breathing, a little bit faster breathing, noticeable breathing. So they're typically traits of dysfunctional breathing patterns. And it's a common symptom of people who have dysfunctional breathing patterns that they feel they just can't take a satisfying deep breath. So I remember I came across this back in 1998, and I was the chronic mouth breather, and my nose was always congested. My sleep was so dreadful. I was snoring, I had sleep apnea, I had constant wheezing. I used the first exercise to open up the nose. Simply hold your breath and you're going to open up your nose. And then I started breathing less air, and I was feeling that air hunger on purpose. And it was the first time that I started noticing the temperature coming into my fingers, that I was able to bring warmth to my hands because I'd always got cold hands. But I also felt a calmness coming to the brain. And that's based on during the practice, I purposely breathed a little bit less air to allow carbon dioxide to accumulate in the blood, and that generates a feeling of air hunger. But as carbon dioxide accumulated in the blood, my blood vessels were opening up and more oxygen was being delivered to the brain. And I think we have to turn upside down what's often, there are so many misconceptions out there about breathing. And it's so common that people have dysfunctional breathing patterns. To give you an example, a Cochrane review said it's about 9.5% of the population. However, with asthma, it's in the literature, it's reported to be about 30%. And with the anxiety population, it's 75%. Now, we have people coming in with anxiety, we have people coming in with panic disorder. I look at their breathing. It's very often fast, it's very often upper chest. The problem with that form of breathing is it's feeding back into their symptoms. So it's not just that anxiety and panic disorder causes breathing to be fast and upper chest, but fast and upper chest feed back into those symptoms. And we also have to bear in mind, you know, we need to change breathing patterns. We need to change breathing from, breathing isn't just one of those things that take a deep breath and all will be well, you know. We have to look at it from 3 dimensions. And I'm not here just to complicate it, but we look at the biochemistry aspect in terms of carbon dioxide. We look at the biomechanics in terms of amplitude of the diaphragm. And we also look at resonant frequency breathing by slowing down the respiratory rate to between 4.5 and 6.5 breaths per minute to influence the vagus nerve and to increase heart rate variability. And it's amazing. And you know this, Tom. I have your book here in front of me. And I have to say, it's one of the most beautiful crafted books that I have seen on the breath. It's really, really well put together. Beautiful book. And bringing people's attention onto their breathing is fundamentally vitally important, because as a Western human society, we have literally become lost in thought, and we are going around with our thinking, you know, constantly consumed. We don't have the ability to place our attention on what we need to place it upon, because we are living in our heads. And I was living in my head for 20 years. And, you know, we're sending kids to school, we're sending kids to university. We're demanding that these kids do well because, of course, their careers are often determined and dictated by the academic achievement. But yet, we're not asking these kids, we're not asking, how are these kids sleeping? Do they have the mouth open or closed at night? How are these kids breathing? And are these kids consumed by thought? So, you know, academic achievement based on ability to concentrate, but not teaching the kids how to concentrate. Where have we gone wrong with this? Because we have absolutely gone wrong.
Yeah. I mean, it's interesting how basic it is. You know, you talk about mouth breathing, especially in your sleep, and mouth breathing in general, and it's such a simple thing to change. You know, in your book, you talk about using tape over the mouth, which I've been experimenting with.
With a beard, not so easy, but you know yeah,
it's horrible. Like I've had to learn to stick it right under the beard. But I think I was also I got really into it when I first read the book, and I was even putting tape on and then under my face mask, because we're in COVID right now, and going out, and no one would know that I was nose breathing deliberately. But I found that I wasn't necessarily a mouth breather. But as soon as I started any kind of aerobic exercise that wasn't yoga, I would start mouth breathing. You know, if I was on my bike, and one thing your book's actually done is make me more mindful of my breath, but for different reasons. So it's increased my breathing mindfulness, but for different reasons. And I have noticed the effects of kind of stamina when I've switched to nasal breathing on my exercise bike. So that's really good. You mentioned asthma there, and you yourself were asthmatic, quite severely asthmatic for the first kind of half of your life. And you went to study with Dr. Konstantin Buteyko. And I guess your earlier books are more specifically about Buteyko and about asthma.
Yes.
When did you realize, because the oxygen advantage is much more broad in its scope, it's for anyone really, even up to athletes. When did you kind of realize how this isn't just necessarily for healing the sick, but for performance and increasing performance in the healthy as well?
There was an exercise, well, there's a couple of reasons. Number one was I was giving mindfulness with functional breathing. So we called it the Mindfulness Buteyko method back in 2010. And I'm a huge proponent of mindfulness. But the only thing that I would like to contribute is this. Mindfulness was developed 2,500 years ago, and we live in fundamentally different times. And I'm not sure if anapanasati and focusing on the breath is going to change dysfunctional breathing patterns. So what I wanted to do was people with anxiety, this was as a result of the economic crash here in Ireland, there's a lot of anxiety. And I was giving courses and they were well attended. We had about 3,000 people attend these short 2-hour courses. And I was bringing people out of their head onto their breathing. But I was showing them how to increase blood flow and oxygen delivery to the brain, to have a calming effect on the central nervous system, but also to improve their sleep. Because I really think that, and the literature shows it more so with children, that children with sleep disorder breathing, and I was one of those kids, were more prone to ADD, ADHD, and were more prone to, as a result, typically with that ADD, ADHD, you have a racing mind, and that's more conducive to a stress response. So giving those courses, 90% of the people attending were female, not male. And that was one issue. And then I was looking at, well, males don't typically go to yoga. Males don't typically do meditation. If you turn up to a meditation retreat, now I'm not going to say this is always the case, but I think there's a predominance that the female is much more interested in breathing and spirituality and taking their attention inwards than the male. Now, but I think it's the male that needs it most, because it's the male that's not able to deal so well with mental health issues. It's the male who, unfortunately, is dying more by suicide. Now, with social media, that's changing with young girls, that's another topic for discussion. But I wanted to bring in a breathing technique that was appealing to males. And that's why I brought in more of a sports-oriented and performance-based. And because, you know, we think about mindfulness, or we think about focusing on the breath, and really what we're talking about is training the brain. We are training the brain to bring space between thoughts so that we can concentrate and we can focus with 100% of our attention. And those traits, Tom, those traits aren't just for the guy who's interested in spirituality. They are for the business person. They're for the sports person. They're for the family person. You know, I started focusing on my breathing 20 years ago. And I went to a university in Dublin called Trinity College in Dublin. And I had to study phenomenally hard there. Not because I was stupid, but because I didn't have the concentration to focus. And I spent 4 years at that university. And if somebody was to offer me a trade, the 4-year degree that I achieved versus the ability to take control of my thought processes, I would choose the ability to quieten my mind any day of the week. And it has done so much more for me than what I learned in the whole academic achievement. And I'm not saying that academia is not right. Of course, it's important to train the brain. And it's important to be able to teach us how to reason and analyze and decipher information and break it into tiny pieces. But it's not just about teaching us how to think. We should also be taught how to stop thinking. But unfortunately, teachers are, like the rest of us in Western society, they are stuck in thought. And the academics and professors in the university are even more stuck in thought. And I often found it fascinating that kind of the running joke is, if I have somebody coming in with a PhD, automatically I get tense, because my first issue is to try and get them out of their heads, because they've spent years training the brain, and they're spending years, everything is consumed in thought, and we need to get them out of the mind. So that was one aspect of it. And then there was an exercise physiologist come over from Sweden, And he said, could you show that you could reduce lactic acid in athletes? And I said, well, I'm not sure, but it kind of makes sense that if we can increase oxygen delivery to the tissue, that we can reduce lactic acid. But the more I went down that route, then we realized that we could delay lactic acid and fatigue. And that's why that book, The Oxygen Advantage, was born. However, it's just done full flight, because now I've written a new book, and it's not going to be so performance-based, but it's looking at the application of breathing for overall health. And it's looking at it in terms of heart rate variability, but also women's breathing. Like me as a man, I've had women sitting in front of me doing breathing with them since 2002, almost 20 years. And I never considered the effect of the monthly cycle on the impact it has on breathing, despite it being known since 1905. Women's breathing is very much different to men's breathing because of the hormonal changes. And PMS, premenstrual syndrome, is very much impacted by how they breathe. And the increase of progesterone during the monthly cycle at different stages, causing chronic hyperventilation, causing CO2 levels, carbon dioxide in the blood, to be reduced, increasing pain perception, reducing pain thresholds, contributing to fatigue, contributing to exhaustion. So, the application is absolutely vast, and it's amazing. And one thing I'm thankful for is that breathing is now getting the attention it finally deserves. And people need to realize the depth that we can go with breathing. It's not just about take that deep breath, because that's often what we hear, or breathe in through your nose and out through your mouth. We need to really go more than that.
Yeah. I mean, a lot of the, I guess, the techniques in your book use air hunger, and there's some breath holding in there. And a lot of the people that will be watching this channel and this video are generally interested in yoga. And in yoga, it's seen as quite advanced. Any kind of breath holding technique is seen as quite advanced, something that might not be taught, especially not to beginners, but to even for the first few years that people are practicing. And I wonder, there's so much evidence base in your book. So much of it is referenced in peer-reviewed studies that you've included in there. There's so much more biofeedback that's available about blood oxygen level and VO2 max. Do you think that because of the technology, because of the deeper understanding we have now of why these techniques work, that they're more accessible to beginners?
Yeah, it's a good question. I think the yoga question is very interesting. I'll give you a story. There was a woman from Falls City in Seattle, and her name is Robin Rottenberg. And I'm just going to get her book. Just 1 minute there. And Robin was teaching yoga for 30 years, and she was teaching it for medical purposes, primarily for health. People coming in with very debilitating conditions, she was using yoga, so more medical yoga. And she developed chronic fatigue syndrome and asthma, and I think sleep apnea. And with that, then she came across the Buteyko method, and she started applying it. And she became intrigued because yoga was bringing her so far, but when she started doing the breathe light exercise, that was bringing her another step. So she decided to go back to the sutras, or as best, the question she asked was, the original yoga, what was it about? Was it about hard breathing, or was it about subtle breathing? And her conclusion was, from reading that, it was about subtle breathing. So she spent 4 years writing a book, and the book is called Restoring Prana. And I think any yoga instructor who reads that will change the practice of their breathing. Because the rule of thumb is, in a yoga studio, we should never hear anybody breathe. And the reason I say that is because if you hear them breathing, you know that they are breathing too hard. And it's possible that they're getting rid of too much carbon dioxide from the blood through the lungs. And this in turn is causing blood vessels to constrict and less oxygen to be delivered. The yoga instructor is focusing mainly on the biomechanics. They're focusing on slowing down breathing with greater amplitude of the diaphragm. but it's very important to also consider the biochemistry, not to breathe too much air because you sacrifice that if you do. And it's also very important to consider resonant frequency breathing. So say, for instance, if you have an advanced student of yoga, the ability of a yoga student to be able to perform breath holds is not because of is not because of the practice of yoga. Their ability to perform longer breath holds is because of their everyday breathing practice. If I have a student in front of me, I'm concerned with how is that person breathing when they go to sleep? How is that person breathing when they walk down the street? How is that person breathing when they're driving their car? Because if we can improve everyday breathing patterns, and by that, by improving the biochemistry of breathing in terms of reducing the chemosensitivity to carbon dioxide, then that individual can do longer breath holds, and they will be naturally a more advanced student. So, it's fascinating. It's fascinating that there's just a couple of more dots to be joined, and I can understand. Like, I'm a Buteyko instructor, and Buteyko is all about carbon dioxide. That's what Buteyko is about. But when I started the Oxygen Advantage in 2014, it gave me the freedom to explore breathing from whatever modality I could, because I wasn't limited to my training. It's very normal that when we get trained, that we stay within that realm. Because who was I to change the Buteyko method? The Buteyko method is the Buteyko method. I cannot change that. I can deliver it as best I can, but I'm following the teachings. And the biochemistry is one part, a fundamental part, but there are two other dimensions that I was overlooking. And the yoga instructor is focusing on the biomechanics, and the heart rate variability instructor is focusing on resonant frequency breathing. The heart rate variability instructor is not necessarily focusing on the biomechanics and not necessarily focusing on the biochemistry. So as human beings, we're kind of stuck in our own silos.
Yeah.
And that's where it's interesting to see the bidirectional relationship. And it all starts with the nose, because if you breathe through your mouth, you're going to breathe fast and you're going to breathe shallow. And by switching to nasal breathing, that's when we start improving everything. But it's not just about breathing through the nose either. But it's a good place to start.
Patrick, thank you so much for sharing your knowledge and wisdom with me today. It's been an absolute pleasure to have you. Where should I direct people to see more of your work?
We've got many videos on YouTube, and we also have buteykoclinic.com is our website for health. So there are, for example, information on children's breathing. There's a free children's breathing course for people with sleep problems, insomnia, snoring, sleep apnea, anxiety, panic disorder, and also respiratory. And then performance-based information, then we have the science in terms of what happens if you stress the body, what happens if you're improving your functional breathing in terms of sports. That's oxygenadvantage.com.
Brilliant. Thanks very much, Patrick.
Thank you, Tom.
If you found that interesting, I've done another video with Patrick where he leads me in what's called the breathe light to breathe right technique from this book. It's a really great technique, a real interesting distillation of what the book's about. So getting used to air hunger and increasing our body's capacity for CO2, or at least the brain's chemoreceptors' ability to sense CO2 more sensitively. I'll also leave links in the description below to all of those websites that he mentioned at the end, as well as to the Oxygen Advantage. If you enjoyed this video, if you have any thoughts or questions, let me know in the comments below. And if you want to see more videos like this, then hit that subscribe button and turn on your notifications for the channel. Thank you so much for joining me.